Hi everybody, Dr. Baumholtz, Baumholtz Plastic Surgery, and I'm going to take a couple minutes, and I know this may be a little bit hard to read, but I'm going to sort of narrate our way through this. And this is about my views on medical tourism. And, you know, it may seem a little bit disingenuous if I've done promotional materials for the practice inviting patients from other places to come and see us here, but I hope as I walk you through this algorithm, you'll understand at least where I'm coming from. Also, the reason I'm doing this is because we've gotten a lot of very interesting commentary on social media about, and it's not new, but people talk about, hey, let's go to Mexico or Tijuana or any number of places, both inside and outside of the United States, for the sole reason that it may be cheaper elsewhere. Whatever the procedure or surgery might be, it may be cheaper elsewhere. So let me just walk you through at least my views on the pros and cons of medical tourism as it pertains to going away. So the only pro I can come up with is that it's cheaper, right? Now, is it possible that you're going to a community where you have family or you are following a particular physician and they have a reputation for whatever it might be? Awesome. There are many, many wonderful surgeons and doctors around the world, but generally speaking, when people are choosing to travel for the sole reason of price, I don't think that that's necessarily who or what they're traveling for. So why should you have surgery done here in the good old US of A, or at least with people that you're familiar with? I'm going to start up here at certifications and quality control. So if you come and see a board certified plastic surgeon in the United States, that's got real meaning. And the meaning is when the American Board of Plastic Surgery certifies me and my colleagues as plastic surgeons, what they're saying is I've completed a uniform course of study. I've been at this for a certain number of years. I went to a reputable medical school. I then did my residency. I then took both a written exam and an oral exam, and I am now board certified. Other measures of quality control, or at least some degree of certification, is your surgeon a member of ASPS or ASAPS. These are the two big international societies that pertain to plastic surgery. Are they a member of their state and local medical society as it pertains to the specialty? So I'm a member of both the Tech Society of Plastic Surgery as well as the San Antonio Society of Plastic Surgery. The anesthesiologists that I work with are board certified anesthesiologists. So there again is another layer of comfort for some to know that the person who's going to put them to sleep is achieved the level of certification to be a board certified anesthesiologist. And then probably equally important is the actual facility. So we go to fully certified facilities, and that tells you, or should tell you, or I'm telling you it should tell you, that right off the bat you know that that facility has certain levels of safety nets. Their employees have met certain criteria to be there. The equipment that they have has all been checked out and certified, and so we really shouldn't have issues with those factors. In terms of follow-up, if you're traveling by plane to go see a surgeon, what have they set up in terms of your follow-up? For us, we can interact with our patients fairly seamlessly through our web portal, a product called Simplast. And it allows us to video conference with patients securely and privately, but also we design plans for patients if they're traveling, how long we want them to be here, what the expectations of healing will be, what are the benchmarks for healing, and what are things to look out for. If you are traveling out of state or out of the country and you go back home and you have a problem, very often you'll end up in an emergency department trying to get someone to help you. And it may be something urgent or emergent. It may just be routine, like who's going to take out your stitches or who's going to take out your drains. And those have some significant costs, many of which are not covered by insurance. How about accountability? When you travel out of the country, what accountability does that surgeon have to you? Here in the United States, there's a medical legal obligation. I, like many surgeons who participate in hospital-based surgeries, are subject to peer review. Our work is constantly being reviewed. We participate in continuing medical education for our board certification and state memberships. And so there's lots of layers that go into practicing here in the United States. And then, do you know what you're really buying when you go someplace else? That includes some practices, I'm sad to say, here in the United States. There is a confusion among many patients about the difference between being a board-certified cosmetic surgeon and a board-certified plastic surgeon. A cosmetic surgeon is not a plastic surgeon. Only someone board certified by the American Board of Plastic Surgery is a board certified plastic surgeon who has earned the right to call themselves that. Anybody else is not. And so I think as more and more patients become aware of that, you'll begin to ask questions, you'll understand the differences. Well, I hope that's helpful. It's my views on medical tourism. And again, if you'd like to know more, please contact us at the office or reach out to us. Thanks for listening.